Medication, dosage errors, wrong drug/dose/patient. Medication dosage errors represent one of healthcare's most pervasive and dangerous mistakes. These errors occur in three critical dimensions: wrong drug, wrong dose, or wrong patient, each carrying potentially devastating consequences. The complexity of modern medicine makes these errors particularly insidious. A single patient might receive multiple medications, each with its own specific dosing requirements, timing, and potential interactions. Even a decimal point in the wrong place can mean the difference between a therapeutic dose and a lethal one. What makes these errors especially tragic is their preventability. They often occur due to factors like similar-looking drug names, poor handwriting, metric system confusion, or simple human fatigue. For example, medications like morphine and hydromorphone have vastly different potencies, yet their names are similar enough to cause confusion. The ripple effects of these errors extend far beyond the immediate harm. A patient given the wrong medication might develop new health complications, requiring additional treatment and prolonging their recovery. In severe cases, these mistakes can lead to permanent disability or death. The most profound aspect of medication errors is their psychological impact on healthcare providers. The second victim phenomenon describes how medical professionals involved in such errors often experience severe emotional trauma, affecting their confidence and future practice. DOSAGE, surgical measure, Oxford and University, inside patients. This error, known medically as retained surgical items, RSI, represents a stark reminder of how even the most routine surgical procedures can go terribly wrong. The most commonly retained items include surgical sponges, needles, and instruments. The human body's internal environment makes these mistakes particularly dangerous. A retained surgical sponge, for instance, can become a breeding ground for bacteria, leading to severe infections. The body may form protective tissue around the foreign object, creating what's called a gossipiboma. What makes these errors especially concerning is their delayed discovery. Patients might experience mysterious symptoms for months or years before the true cause is identified. The psychological trauma of discovering that one has been carrying a surgical item inside their body for years can be devastating. Modern technology offers solutions like radio frequency tagged surgical items and systematic counting protocols. However, the persistence of these errors highlights how human factors and system pressures can override even well-designed safety measures. The most profound aspect is how such a seemingly simple mistake, forgetting to remove an item, can lead to such complex and long-lasting consequences, fundamentally altering a patient's life.
Click subscribe to this channel to get more topics you love.
Wrong site surgery. Operating on wrong body part. Wrong site surgery represents one of the most dramatic examples of medical error, where surgeons operate on the wrong body part, wrong side, or even the wrong patient. These never events, errors that should never occur, continue to happen with alarming frequency. The psychological impact of these errors is particularly devastating. Imagine waking up from surgery to discover that the healthy knee was operated on instead of the injured one, or that the wrong kidney was removed. Such errors often require additional surgeries, extending recovery time and increasing risks. What makes these mistakes especially tragic is their complete preventability. The universal protocol, including pre-surgery timeouts and site marking, was specifically designed to prevent these errors, yet they persist, often due to communication breakdowns, rushed schedules, or cultural hierarchies in operating rooms. The ripple effects extend beyond the immediate physical harm. These errors often destroy trust in medical institutions, lead to severe psychological trauma, and can result in life-altering consequences for both patients and healthcare providers. The most profound aspect is how a few moments of confusion or miscommunication can lead to irreversible consequences, highlighting the critical importance of systematic safety protocols in modern surgery. Misdiagnosis or delayed diagnosis. Misdiagnosis represents a uniquely complex medical error because it often occurs invisibly, with patients unaware that their condition is being incorrectly identified or missed entirely. This error type can transform treatable conditions into life-threatening emergencies. The challenge lies in medicine's inherent uncertainty. Many conditions share similar symptoms, and the human body's response to disease isn't always textbook perfect. For example, heart attacks in women often present differently than in men, leading to dangerous diagnostic delays. Time becomes a critical factor in these cases. A delayed cancer diagnosis might allow the disease to progress from curable to terminal. Similarly, misdiagnosing a stroke as a migraine can result in permanent brain damage during the critical treatment window. What makes these errors particularly insidious is their compounding nature. An initial misdiagnosis can lead to inappropriate treatments, which may cause additional complications, while the real condition continues to worsen. The psychological impact extends beyond physical harm. Patients lose precious time, face increased medical costs, and often experience diminished trust in healthcare providers, affecting their future medical interactions. Healthcare-associated infections. Healthcare-associated infections represent a paradoxical tragedy. People entering healthcare facilities for treatment only to acquire new, potentially deadly infections. These infections exploit the vulnerable state of patients whose immune systems are already compromised. The most dangerous aspect of HAIs is their resistance to antibiotics. Years of antimicrobial use in healthcare settings have created sophisticated bacterial strains that can defeat our strongest medications. For example, MRSA, methicillin-resistant Staphylococcus aureus, has become a dreaded name in hospitals worldwide. What makes these infections particularly challenging is their invisibility. Bacteria can live on seemingly clean surfaces, travel on healthcare workers' hands, and spread through ventilation systems. Even the most rigorous cleaning protocols may not eliminate all risks. The impact extends beyond individual patients. HAIs can spread through healthcare facilities, creating outbreaks that affect multiple patients and staff members. They also contribute significantly to healthcare costs and longer hospital stays. The most profound aspect is how these infections reveal the delicate balance between providing necessary medical care and protecting vulnerable patients from the very environment meant to heal them. Anesthesia errors. Anesthesia errors stand among the most critical medical mistakes because they directly affect the thin line between consciousness and death. These errors can occur during any phase: preoperative evaluation, anesthesia administration, or postoperative monitoring. The most common phase, the most unpredictable, hovering in between, is uncommitted threat. The complexity of anesthesia makes these errors particularly dangerous. Anesthesiologists must carefully calculate dosages based on multiple factors including weight, age, medical history, and other medications. Even small miscalculations can lead to awareness during surgery, organ damage, or death. What makes these errors especially concerning is their immediate impact. Unlike many medical mistakes that develop over time, anesthesia errors often manifest instantly and dramatically. Oxygen deprivation, for instance, can cause brain damage within minutes. The psychological impact can be severe, particularly in cases of anesthesia awareness, where patients remain conscious during surgery but unable to move or communicate. These experiences often result in long-term post-traumatic stress disorder. The most profound aspect is how these errors highlight the precise balance required in modern medicine, where the difference between therapeutic benefit and catastrophic harm can be measured in milliliters or minutes. Birth injuries due to medical inequity. A neutralizing and rescue guide is not. Birth injuries represent some of the most heartbreaking medical errors because they affect the most vulnerable patients at the very beginning of life. These injuries can transform what should be a joyous moment into a lifetime of challenges. The complexity of childbirth makes these errors particularly devastating. During labor and delivery, healthcare providers must monitor multiple vital signs and make split-second decisions. Delayed C-section decisions, improper use of forceps, or failure to recognize fetal distress can lead to permanent disabilities. What makes these errors especially tragic is their long-term impact. Conditions like cerebral palsy, Erb's palsy, or brain damage due to oxygen deprivation can affect a child's entire life trajectory. Families face not only emotional trauma but also the financial burden of lifelong medical care. The ripple effect extends beyond the immediate family. These injuries often require extensive support systems, including specialized education, therapy services, and adaptive equipment. The psychological impact on parents, who may experience guilt and grief, can last a lifetime. The most profound aspect is how a few critical moments during birth can fundamentally alter the course of multiple lives, highlighting the enormous responsibility healthcare providers bear during delivery. Laboratory tools mix-up. Laboratory result mix-ups represent a silent but potentially deadly form of medical error. These mistakes occur when test results are incorrectly matched to patients, leading to wrong treatments, misdiagnoses, or unnecessary procedures. The complexity of modern medical testing makes these errors particularly dangerous. A single hospital might process thousands of samples daily, each requiring multiple handling steps. One misplaced label or data entry error can set off a chain of incorrect medical decisions. What makes these mix-ups especially insidious is their cascade effect. A patient might receive treatment for a condition they don't have, while their real condition goes untreated. Meanwhile, another patient's critical diagnosis might be missed entirely due to switched results. The psychological impact can be severe. Imagine being told you have cancer based on someone else's test results, only to discover the error after beginning chemotherapy, or learning your treatable condition became serious because your positive test results were assigned to another patient. The most profound aspect is how these errors reveal the vulnerability of our increasingly complex healthcare systems, where efficiency and volume must be balanced against accuracy and patient safety. Patient identity confusion. Patient identity confusion represents a fundamental breakdown in healthcare delivery. This error occurs when patients receive treatments, medications, or procedures intended for someone else, often with devastating consequences. The modern healthcare environment makes these errors more likely. Large hospitals, multiple providers, similar names, and high patient turnover create numerous opportunities for confusion. Even simple factors like language barriers or unconscious patients can contribute to misidentification. What makes these errors particularly dangerous is their potential to compound. Once a patient is misidentified, every subsequent interaction builds upon this initial error. Wrong medications are administered, incorrect procedures performed, and inappropriate treatments given. The psychological trauma extends beyond physical harm. Patients lose trust in the healthcare system, knowing their safety depends on something as basic as correct identification. Healthcare providers involved in these mistakes often experience severe guilt and anxiety about future errors. The most profound aspect is how such a seemingly simple mistake, confusing one patient for another, can lead to such complex and far-reaching consequences. The interactions between healthcare providers and communication breakdowns in healthcare settings represent a systemic failure that underlies many other medical errors. These failures occur at multiple levels, between departments, during shift changes, across specialties, and between facilities. The complexity of modern healthcare makes effective communication crucial, yet increasingly difficult. Multiple specialists may treat a single patient, each working with partial information. Critical details can be lost during handoffs, leading to dangerous gaps in care. What makes these breakdowns particularly hazardous is their subtle nature. Unlike obvious errors like wrong site surgery, communication failures often go unnoticed until their consequences become severe. Important medication allergies might not be communicated, critical test results might not be shared, or vital follow-up instructions might be missed. The impact of these errors extends beyond individual incidents. Poor communication creates an environment where mistakes become more likely, trust between healthcare providers erodes, and patient care suffers systematically. The most profound aspect is how these breakdowns reveal the inherent challenge of maintaining clear, accurate communication in increasingly complex healthcare systems where multiple providers must coordinate seamlessly. Preventable blood clots. Preventable blood clots or hospital-acquired thrombosis represent a silent killer in healthcare settings. These dangerous clots often develop when patients are immobilized during hospital stays, particularly after surgery or during extended bed rest. What makes these clots particularly treacherous is their deceptive nature. They can form quietly without obvious symptoms, then suddenly cause life-threatening complications like pulmonary embolism. The first sign might be catastrophic or fatal, and worse. The tragedy lies in their preventability. Simple measures like blood thinners, compression stockings, and early mobilization can dramatically reduce the risk. Yet these preventive steps are sometimes overlooked in the complex cascade of hospital care. The impact of these clots extends far beyond the immediate crisis. Survivors might face long-term complications including chronic pain, reduced mobility, and ongoing anxiety about recurrence. The most profound aspect is how such a preventable condition continues to claim lives, highlighting the critical importance of systematic preventive protocols in healthcare settings. Radiation, overdose/treatment errors. Radiation errors. Radiation errors represent a particularly insidious form of medical mistake because their effects can be both immediate and long-lasting. These errors occur in diagnostic procedures, like CT scans, and therapeutic treatments like cancer radiation therapy. The invisible nature of radiation makes these errors especially dangerous. Unlike surgical mistakes, radiation damage might not be immediately apparent. Patients can receive excessive doses without realizing it until symptoms develop days, weeks, or even years later. What makes these errors particularly tragic is their accumulative effect. Each exposure adds to the patient's lifetime radiation burden. Overdoses can cause severe burns, organ damage, and increase the risk of secondary cancers, ironically the very thing radiation therapy often aims to treat. The psychological impact is profound. Patients undergoing radiation therapy already face the stress of cancer treatment. Discovering they've received incorrect doses can shatter their trust in medical care when they're most vulnerable. The most devastating aspect is how these errors can transform life-saving treatments into sources of additional suffering, highlighting the critical importance of precise calibration and multiple safety checks in radiation medicine. Electronic health record data entry mistakes. Electronic health record (EHR) errors represent a modern paradox in healthcare. Systems designed to reduce mistakes can sometimes create new ones. These errors occur when incorrect information is entered, copied, or transferred within digital medical records. The complexity of EHR systems makes these errors particularly pervasive. Drop-down menus, autofill functions, and copy-paste features can lead to wrong information being perpetuated throughout a patient's record. One wrong click can result in cascading errors affecting multiple aspects of care. What makes these mistakes especially dangerous is their persistence. Once incorrect information enters the digital system, it can follow patients across different healthcare providers and facilities. Wrong allergies, incorrect medications, or inaccurate diagnoses can become part of a patient's permanent record. The impact extends beyond individual care. These errors can affect population health studies, quality metrics, and healthcare planning, creating ripple effects throughout the healthcare system. The most profound aspect is how technology, meant to enhance medical accuracy, can sometimes introduce new forms of error that require constant vigilance to detect and correct. Medication contrary to oversight. Medication contraindication oversights occur when drugs are prescribed without fully considering their interactions with other medications, existing conditions, or patient-specific factors. These errors represent a complex challenge in an era of increasing polypharmacy. The danger lies in the multiplying effect of drug interactions. As patients take more medications, the potential for dangerous combinations increases exponentially. What might be safe individually can become deadly when combined with other drugs or existing health conditions. What makes these oversights particularly hazardous is their subtle onset. Adverse reactions might develop gradually, making it difficult to connect symptoms to specific drug interactions. By the time the connection is made, significant harm may have occurred. The impact often extends beyond physical symptoms. Patients may lose trust in their healthcare providers, become anxious about taking necessary medications, or develop new health problems requiring additional treatment. The most profound aspect is how these errors reveal the increasing complexity of modern medicine, where managing multiple conditions with multiple medications requires incredibly detailed attention to potential interactions. Emergency room triage errors. Emergency room triage errors represent critical mistakes in the first line of medical response. These errors occur when the severity of a condition is either overestimated or, more dangerously, underestimated during initial assessment. The high-pressure environment of emergency departments makes these errors particularly dangerous. Staff must make rapid decisions with limited information, often while managing multiple critical cases simultaneously. A seemingly minor complaint might mask a life-threatening condition. What makes these errors especially tragic is their time-sensitive nature. In emergency medicine, minutes or even seconds can mean the difference between life and death. A heart attack, misidentified as indigestion, or a stroke dismissed as a migraine, can have catastrophic consequences. The psychological impact extends beyond individual cases. Patients may develop anxiety about seeking emergency care, potentially delaying treatment for future serious conditions. Healthcare providers carry the emotional burden of knowing their initial assessments can have life-altering consequences. The most profound aspect is how these errors highlight the incredible challenge of making accurate medical decisions under extreme time pressure, where both overtribe and undertribe can have serious consequences for patient outcomes.